Good evening. Welcome to this evening's Instagram live session where we're going to be talking about the services available here at Breast Cancer Now to people with breast cancer or breast concerns, and also services that are available for kind of friends and family for people that have a breast cancer diagnosis. In a moment, Michaela is going to be joining us from our Here For You team, which is a personalised referral route, and she's going to tell us all about that service. And she's really well placed with that service to kind of have a good understanding of the service that we provide here at Breast Cancer Now. And then afterwards, also going to be joined by Karen, who's a volunteer who's got her own personal lived experience of breast cancer. And she's kindly agreed to come and share her story and some of her experiences of using our services. So just to start with some housekeeping, this live session is not a confidential space, so it's also going to be recorded. So if any questions that you want to ask in the chat are of a sensitive nature, you might prefer to give us a call on our helpline to speak to one of our nurses. The number for that is 0808 800 6000. And we're open Monday to Friday 9 till 4 and Saturdays until 1 o'clock. Alternatively, you can write to us via our Ask Our Nurses written service at nurse@breastcancernow.org. We will try and answer as many questions as possible this evening. If we're not able to get through to all of the questions, then you can message us directly on Instagram via our direct messaging, and we can get back to you in that way. And there will be a link to the survey that you can find in our bio on Instagram, on our Instagram page at the end of the session. And it'd be really helpful if you could complete this feedback. It's really helpful to help us improve our services, and then you can send for any topic requests that you might kind of, so that we can tailor our sessions to kind of suit your needs. So without any further delay, I'm going to introduce Michaela to come and have a chat.
Hi Natasha, how are you
Hi,
doing?
Michaela. Good, thank you. Thank you for joining us this evening. And I guess we can just jump straight into it. Would you like to introduce yourself and what your role here at Breast Cancer Now is?
Absolutely. Good evening, everybody. My name is Michaela, and I manage Here For You, which is our personalised referral route into all of the different services that we offer.
Great. And are you able to tell us a little bit more about the personalised referral route?
Absolutely. So, Here For You basically provides anyone who's got a breast diagnosis, a breast cancer diagnosis, with personalised and timely access to all of the different trusted information and specialist support services at Breast Cancer Now. And we do this through a healthcare professional referral. So we are supporting primary and secondary breast cancer patients. And at the moment, we're working with over 60 hospitals in England. And in the last 12 months, already had like over 1,300 patients coming through our doors who really wanted to find out about the support services. And so we introduced them to the beautiful things that we do by actually having them an initial phone call, and then a 3-month phone call, and a follow-up 6-month phone call as well. And the reason we do that is basically, people have told us that it's very difficult sometimes to access the right type of support, especially when being newly diagnosed. And obviously there is also something about confidence levels and not knowing how to reach out as well. So, we've asked healthcare professionals to make referrals on their patients' behalf. And what we found was that actually people whose first language is not English is taking that up. So I'm really chuffed about that, because sometimes that is a little bit more tricky. And we've got interpreters similar to the helpline and our peer support service in Someone Like Me. So we really are able to tailor the conversations for each of the referrals that we are getting. And to make this a little bit more real, I can give you an example. When I actually recently spoke to a younger woman, I had an initial phone call with her. She's been recently diagnosed with a primary breast cancer diagnosis, and she also just started treatment. So we talked about fertility, we talked about changes in the body and the shape. So that was one of the real big concerns for her. And so basically I was able to make sure that she's aware of someone like me, our peer support service, where we can match a person with a lived experience to somebody who's going through their treatment at this moment in time and just support them on a peer level. We also managed to talk about our Younger Women's Together events as well, so that actually anyone aged under sort of 45 and under is able to get a bit of peer support at those events and groups, and they can be face to face or online as well. And then depending on the sort of preference in this case, it was a little bit more through reading. We also linked her in with the forum and our web pages just to make sure that she can get all the information there and also read about other people's experiences. But we also have men with breast cancer coming through our doors, you know, so we have had people referred to us, and again we managed to inform them about our forum pages that are dedicated to men who actually go through breast cancer, and all the different virtual meetups and the helpline obviously as well. So we try and create as holistic approach to that as we can, depending on what the person needs.
I mean, it's a really valuable service, I think, as well, because we do provide quite a lot of different services, and I think if someone's looking for some support and they don't really know kind of what is out there or what might be suitable for them, then they can just have a chat with your team and kind of be pointed in the right direction. So and it's really good that I'm sure the people who work in hospitals find it a valuable service as well, to kind of take some of the pressure off of that side of things. But just wondering, is it possible, because you mentioned that hospital referrals, can people refer themselves to the service?
So with Here For You, we're going to pilot a self-referral route, which is really exciting. So watch this space. So this is, like you said, Natasha, really to help people navigate the sheer volume of support that we have got on offer. In the meantime, though, on our website, you're able to just go on the different events and you can register yourself right there and then for all the different services. And obviously the helpline is able to navigate with that as well.
Yeah, you're right. So the helpline, people quite often, it's kind of almost like a different type of personalised referral route as well, because if people don't get referred in that way, but they call the helpline, then we can point them in the right direction and refer directly from the helpline. So definitely, if people are kind of wanting to kind of be pointed in the right direction, they can contact the nurses on the helpline.
Yeah.
So you kind of mentioned a little bit about kind of peer support services. So like we quite often hear from people that call the helpline that sometimes, even though people are really well-meaning, sometimes friends and family, they might quite not understand exactly what someone's going through, and who will find it really helpful to be able to speak to someone who kind of has a similar experience. So quite a lot of our services are kind of what we call peer support. Are you able to kind of talk a little bit about some of these types of services that use the peer support as part of their kind of practice?
Oh, absolutely. And most of our services have got a peer support element because that's just crucial. If you've not been there, it's a very difficult conversation sometimes to have. And for Breast Cancer Now, obviously, we have got specific services for primary breast cancer patients and secondary breast cancer patients across the whole of the UK. And so again, some of them are taking place face to face, other ones are taking place online. And to give you an example of one of those services, it's the Moving Forward course, and this is really aimed to anyone who has finished their primary breast cancer treatment, and it's a really interactive course that focuses on that peer sharing an element as well. So people are coming together and really look at common concerns, discuss that within the group as well about the impact of having had a diagnosis and the treatment. And so our trained facilitators are really able to use those conversations together with a well-being framework to try and provide everyone with tools, knowledge, information to really help people move on, and we all learn from each other, so that is one of the things that's really important. I mentioned the younger person that I spoke to a little while ago as well earlier, and the matching of someone like me peer support service is really important, and I think Karen is going to talk about that in a little bit obviously as well, so you can hear all about that later. But for us, matching a person with a lived experience who's got specific questions and is looking for some sort of guidance on the experience of others as well is an important factor, just to kind of like hear that lived experience part of it. And obviously, we've got all the different wonderful support services for people living with secondary breast cancer as well, and the groups that we've got, the face-to-face sessions, the online sessions, are a real supportive, structured approach to have conversations that might sometimes be a little bit difficult. And again, our trained facilitators are really guided by the group and the conversations that they've got. Sometimes that might be anything from talking about travel insurance when you've got a secondary breast cancer diagnosis, but other times it's talking about the different treatments, and then other times again it's about speaking to people who've got another long-term health condition and what that might be like. So we really are trying to accommodate as much peer support as we can. We also have got our younger women's services for secondary breast cancer as well, and we've got online courses and we've got also residential courses. So again, it's a real opportunity to meet like-minded people, to have that conversation that you might otherwise not necessarily have with family or friends as well. And so our Living with Secondary Breast Cancer event for younger women, the next one is up in Leeds. So on our website you'll find all the different details. Now, we've got a variety of face-to-face support services, and we are really keen to make them as accessible as possible. And so we've got an access fund that was kindly donated by the Tickle Pink campaign through ASDA, where we can actually look into supporting anyone who's got financial hardship to get to our face-to-face events as well, and our groups. So again, we're trying to break down those barriers so that people can access those peer support sessions.
I think it's really important as well, because not everybody, and sometimes people find that having breast cancer treatment they're not able to work, that sometimes kind of money can be a bit of a worry, and it's still kind of really important that people who might have kind of financial difficulties are able to access the same support. So and how can people access the access fund if they needed to find out about that?
Again, we've got the information on our web pages and in services. As soon as we hear anyone mentioning that there might be some sort of obstacle to get to our face-to-face groups, we'll just pass it on to our services team, and it's all done automatically.
Great. Okay. So, I mean, you've been talking a little bit about the kind of peer support, and obviously that's a really valuable thing, and people find it really helpful. But some people are not really keen on or comfortable with group support. Some people kind of want the information and the support, but maybe not in a group setting. Maybe something more kind of one-to-one, or just somewhere that they can get the information that they need. So, I mean, obviously we do have the helpline, so people can call and speak to somebody or email us. But what other support is available for people that don't really want to kind of get involved in some kind of group thing?
Oh, people's preferences are so important. Not everybody feels comfortable to share in a group. So yes, we have got alternative ways of supporting people who might be a little bit shy, or, just want to take in information in a different way. And so we've got a lot of other support available. For example, we've got our Speakers Lives programme, where people can register their interest to listen to an expert speaker on an expert topic, and they can just click on a link and absorb the information without having to engage. And some of the topics that are coming up as well are about healthy eating, better sleep, lymphedema, and lots of others as well. We also have got our forum that people can actually then go through different topics and read up about some of the information that's then being answered by our lovely nurses obviously as well, and download the information, leaflets, booklets that we've got available. But we have got some of the support services also through the phone. So again, we've got someone like me that's on the phone here for you. Obviously we reach out as well by phone, the helpline, and ask our nurses. There are different ways of engaging with us if group settings aren't necessarily your cup of tea as well. But best to go and have a little look on our website and reach out to us, and I'm sure we can direct you to the best option for you.
Great, thank you, Michaela. Now, in a moment, we're going to move on to Karen, but there has been a question that's come through on the chat from Pesro asking if we support people post-cancer treatment who are going through reconstructive surgery. I mean, that's, for me, straight away, I'm thinking someone like me. I don't know if you'd agree with
Absolutely.
that.
Absolutely, exactly. Those are the types of questions that are coming up as well. And again, there are different ways that we can do that. So, someone like me, for example, is able to match up any person who would like to talk to somebody about reconstruction, especially if there might be different ways of reconstruction. So, we can match a person up with multiple volunteers who have had different types of reconstruction so that you can kind of like get all of that information that you need. The other thing obviously about that is that it might be useful to also go on our forums. It might be useful to just get that information there as well. So again, we are here at any point, and obviously, you know, any concerns, the helpline is right there. Give them a call. Very happy to have a conversation about different concerns as well. So at any point, whenever you feel is the right time for you to access us, you're very welcome to.
And also, obviously, we've got lots of health information on our website, so anyone can kind of search for what they're looking for to do a reconstruction or whatever it might be that you're kind of wanting a bit more information on. So that information is all there on our website. But thank you so much for joining us tonight, Michaela, and kind of talking a bit about the services. Hopefully people that are watching might kind of find the information useful and kind of, you know, mention it to friends or family or kind of reach out themselves. But yeah, thank you so much for joining us. It's been really
Thanks for
informative.
having me. See you later.
See you later. Now, hi, Karen. Thank you for joining us. It's really we're really grateful to kind of have you as a kind of volunteer and somebody who's had your own experience of breast cancer to kind of come and talk to us this evening about your experiences. Are you able to just tell us a little bit about yourself and kind of share your kind of personal experience?
Yeah, so I was diagnosed in 2016 with hormone positive breast cancer at the age of 44. I was relatively fit and healthy, but found a lump. And then that was me on the sort of cancer path of treatment. I had a mastectomy and VECT chemotherapy. I had to have 6 sessions of that. 15 rounds of radiotherapy, and then on hormone therapy for the next 10 years, which I'm still currently on just now.
So you had the whole lot basically.
Yeah.
So it sounds like quite a difficult experience for you. What kind of led you to breast cancer now and kind of prompted you to reach out? And how did you find out about us actually as well?
Well, obviously, initially when I was diagnosed, you're given all the pamphlets and breast cancer now helpline services, all the support services were on these leaflets. But to be honest, at the time, I was quite a positive person and never ever really thought that I would need to seek external support. I've got a really supportive family, friends, neighbours, work network everywhere. However, when I started treatment, things just were really bad. I was hospitalised after my first chemotherapy and really had every side effect going. I was so ill that I just was so just down on my knees. I just couldn't find a way to cope, and all the family and friends round about me, everything they were saying just wasn't what I was needing to hear. They were great with their support. They're sort of, you know, you're brave, you're doing well, you'll get through this. But inside my head was just scrambled, and I really couldn't see a way out of getting through the treatment alive, if I'm being honest. So how I accessed the services initially was, it was a Saturday morning, and I'd had chemotherapy on the Thursday and was sort of on the bathroom floor and crying, bawling my eyes out, and just said I just can't cope with this treatment and I'd rather give up with the treatment than go through this again. I think I was just scared I was going to be hospitalised again and have to go through like the 18 weeks of how I'd felt since the beginning of starting the treatment. And my husband, he had never really seen me be so low and unpositive, and he then went and looked out the pamphlets that had been given initially at the hospital and happened to see the helpline number. And with it being a Saturday, he noticed that they were open till 1 o'clock on the Saturday. This was about 10:30 a.m. on the Saturday morning. So he sort of prompted me to phone, and again, I did take a bit of prompting because I just sort of didn't really want to speak to him. I just wanted to shut myself away in the bathroom. However, I'm so glad I did pick up that phone. I literally bawled down the phone for about 20 minutes. I couldn't really speak to the nurse. She was so lovely to me and basically said, look, speak when you're ready. I'm here. I'm not going anywhere. So when I finally did compose myself, I just was able to say, look, I'm not coping and I don't know how I'm going to cope. And straight away she said, listen, we're here for you all the way through this, and whatever way we need to be there for you. And she mentioned the Someone Like Me service on the phone to me, that she could match me up with somebody of similar age, diagnosis, circumstances, treatment plan, who was further down the line. I think the girl I get matched with was 5 years down the line. So I agreed to that, and by the Monday morning she phoned me back to say that the girl that they'd matched me with was available to take a phone call when I wanted to have a phone call. So I just said, can she call me now? Almost. So later that day, a girl, Sarah, phoned me, and she was just such a tonic. She just gave me hope, that I didn't have, positivity. She was 5 years on from this. She had been exactly where I had been. She hadn't tolerated the chemotherapy very well at all. So she sort of mirrored how I'd been on my first chemotherapy. So for me, that just that somebody else had walked in your shoes and had felt the way you felt and you weren't alone. So Sarah arranged with me to phone me sort of a few days before my next chemo round, just as a wee sort of check in and see how I was doing. And she just said all the right things, and I would come off that phone call and my husband would say, you sound and look more positive going into the next round of chemotherapy. So that was great for the family to be able to see that this girl, a total stranger, just made everything so much better for me. And then she would phone me again sort of 5 to 6 days after my chemotherapy, just to see how I was doing, what the side effects were. And she sort of gave me pointers saying, I did this or I did that and whatever. So that was just the best thing that I had to carry me through the chemotherapy treatment.
Well, it sounds like you had a really difficult time. So, I'm really pleased to hear that you found that particular service helpful. So you mentioned the helpline and Someone Like Me. Were there any of the other services that you used?
Again, in the middle of the night, I used the forum a lot when I was lying wide awake and the worries were right there, and you didn't want to worry your family, wake your family up. So I used the forum just to kind of navigate around lots of different things, and I found that really, really helpful. Although I didn't engage in chatting, just that the information was out there. So I used that a lot of the time as well. And then at the end of my active treatment, I then went on a moving forward course. Again, I had been given that information, but again, kind of thought, I'll be fine, I'll get back to work, life will pick up. But again, I think when you come out of active treatment, you're sort of, the appointments are few and far between. You're expected to feel better and get on with life, and everybody thinks you're better. But in my head, I was just full of worries. I was really vulnerable. I was so fatigued after the treatment. I felt as if cancer actually consumed me more ending treatment. I think when you're in treatment, you're sort of being sort of guided along and held by the hand with so many professionals that I was sort of cast adrift and like, right, I need to go on with this, and felt I couldn't cope with getting on with anything. So the moving forward course I signed up for was just amazing for me. It sort of answered any fears and worries that I had, and it was just good to step into that course amongst all the women and know that everyone was almost feeling like that. So it was pretty normal how I was feeling, where I think people like family and friends don't quite understand that you're not feeling normal and upbeat, that you're finished all the treatment and have got through it. And I liked as well in the course the fact that a lot of, again, there's so much, don't eat this, don't do this, or you should do this and do that. And all these myths were all sort of put out, and you sort of given clarity of what, what is a load of rubbish and what's fact, sort of thing. So I really enjoyed that. And again, understanding like menopause symptoms that you're put into with the hormone therapy, sort of exercise tips, nutrition tips. I just got so much out of that at a time when I was really, really, really vulnerable at that time.
A lot of tips and tricks to kind of help you, because
Just
we hear it so often on the helpline that that exactly what you said there, that people find that they almost, as though people around them, like the treatment's over, they expect you to be kind of back to who you were before, but quite often people say that they don't feel like it's like that it's not the same as it
no,
was before. It's like a new normal. So
you,
yeah.
yeah, I think the fear of it coming back, it just consumed me. Just having the cancer where we're going through treatment, I think, as I said, you just sort of roll with it at the time, as hard as it is. It's different anxieties when treatment ends. So the moving forward course just sort of gives you some coping mechanisms and moving forward back into life.
Yeah, lots of tips and tricks about how
Yeah,
to kind of get back to some form of life, even though it's not the same as yet you had before.
yeah.
And so, what would you say to some other people that might be watching that are feeling a bit kind of isolated, need a bit of support, but they don't really know where to turn, or maybe feeling a little bit apprehensive about reaching out? What would you say to somebody in that situation?
To look on the website and lift the phone to the helpline, or go online, and there's lots of things that you'll be signposted to, but I think the nurses on the helpline were just amazing. Although I perhaps would have read the title "Someone Like Me" or "Moving Forward," I didn't really know what they were. So the nurse being able to explain that to me and set all that up for me was just amazing. So yeah, reach out to the charity, absolutely, no matter what stage you are at in your journey of treatment finished, whatever. Just reach out to the charity.
Yeah, no, exactly. I think that's a really good tip. Actually, just pick up the phone. We're here to help. So I'm really glad that you kind of got something out of it. And obviously, you're also volunteering for the charity now. Because a lot of people kind of want to give something back. What made you decide to become a volunteer, and how's your experience been of that?
Again, we up in Scotland. I know they still do it in London, but we had the show Scotland. So that was back in 2016, and my family applied for me to be part of that show and model in it. Totally out of my comfort zone, but it was the most empowering experience I've ever had. My confidence was really low at that time, and the charity, just the whole build up to the show and everything, just gave you the confidence that I needed. And I saw on the night just how much work goes in from the charity for the show to go ahead, but also the sponsors and donators that are helping support that. And again, just listening to how much goes in. I know we have research, but to the support services. And for people like me, these services are free, and they run all over the country, online. So I know the work and effort that goes into running all these courses and services. So I just wanted to give a wee bit back as a thank you. So I started off in the public health awareness team, sort of going out into businesses and different fields, just sort of, checking the signs and symptoms of breast cancer. And then I've been on the Louder Voices team as well. So I do a lot of work within sort of different studies and focus groups, which I find really interesting, taking part in them and then seeing where the study sort of goes. It's a pilot study and how far it progresses, and that it comes to fruition in the end that women like me will benefit from these studies. And then also I'm a moving forward volunteer. I got so much out of the course. I was really keen to help out in these courses, and I love the fact that I'm 8 years down the line now. So I'm going into these courses, and the women sitting in the room I've been there and full of fear and worry about cancer, and I can give them a wee bit of hope. I like that they feel hopeful. That I'm sitting there and I'm back to life. I'm feeling healthy. I'm feeling well. So yeah.
Yeah, and I'm sure it's really kind of important to, I know that it's actually from doing some of the moving forward courses myself, that the volunteers that have kind of been through it and, like you said, give some hope.
Yeah.
And also, if anybody out there is kind of interested in volunteering, if you're kind of ready for it, because obviously not everyone's going to be ready for it, or not everyone, it's not going to be for everyone. But if you do want to, then you can find more information on our website on the Volunteer Hub. So you just need to go on the Breast Cancer Now website and kind of search for the Volunteer Hub. And Just wanted to say thank you so much, Karen, for joining us tonight, and also thank you for all you've done for supporting breast cancer now. It's really kind of valuable having volunteers like you that kind of want to kind of help. The charity wouldn't work without kind of people like you kind of giving back.
No,
Thank
thank
you
you for
so much
having
for joining
me.
us. You're very welcome. And so just to kind of finish off then, thank you to everyone who's watched, and obviously thank you to Karen and Michaela for joining us this evening. We hope you found tonight's information useful, and that you'll be able to kind of use it to access or recommend some of the things that we've talked about. And it doesn't look like there's any other questions that have come through, but again, as mentioned earlier, if you did have anything you wanted to ask, then you can either send a direct message through to Instagram or contact our Ask Our Nurses service via email, a nurse@breastcancernow.org, or you can phone our helpline on 080 800 6000. I think that's right. But you can find it on our website just to make sure. And just a reminder that you can find a survey to give some feedback in our bio after the session. This will be recorded and you'll be able to find it on our YouTube channel, and it will also be in as a reel on our page after the session's finished. The next live session that we have from Breast Cancer Now is a Facebook live session tomorrow night at 7 o'clock. About breast awareness with one of our nurses, Sonia, that will be talking to Manvi, also who works in the public health team at our Breast Cancer Now. And just another reminder again that you can contact us for any questions or find any information on our website about any of the services we've talked about tonight. So thank you so much for watching, and have a lovely rest of the evening. Goodbye.